All right, let's jump right into a really fascinating medical mystery. It's one that connects two things you'd probably never expect to be related: the health of your bones and the health of your heart. It's called the calcium paradox. And it turns out the key to solving it is a vitamin that honestly most people have never even heard of. So here's the central puzzle that has had doctors, especially cardiologists, scratching their heads for years. They kept seeing patients who had coronary artery disease, and these same patients also had osteoporosis. Now, that seems totally backward, right? How can one part of your body be starving for calcium while another part is getting clogged up with it? What on earth is going on here? For a long, long time, when doctors were faced with a patient with thinning bones, the advice seemed perfectly logical. The line of thinking was really straightforward. If your bones are losing a critical building block, well, you should probably just take more of it. And that building block, of course, was calcium. It became the go-to solution, both as a prescription and just something you'd pick up over the counter. And so millions and millions of people started taking calcium supplements every single day, thinking they were doing the right thing for their bones. But this is where the story takes a really sharp, unexpected turn. Researchers started digging into the data, and they noticed a really disturbing trend. What if this well-intentioned advice wasn't just not working? What if it was actively making the other half of the paradox, the heart disease, even worse? And that leads us to this pretty staggering number. Major studies started to show that taking over a gram of calcium supplements a day was linked to about a 20% increase in cardiovascular risk. A supplement that was supposed to help was actually potentially causing serious harm. And look, this wasn't just some small one-off study. We're talking about the massive Women's Health Initiative, which found that calcium supplements could increase mortality by as much as 22%. And what's really wild is that this risk didn't go away even when vitamin D was part of the picture. The whole scientific community was kind of stumped. The calcium clearly wasn't going into the bones, so where was it going, and why was it so dangerous? Well, the answer to this whole paradox, the key that unlocks the entire mystery, lies with a nutrient that's been flying under the radar for decades. And that brings us to the real hero of this story, vitamin K2. Now, it is crucial not to confuse this with vitamin K1, which we'll talk about in just a sec. Vitamin K2 is a fat-soluble vitamin with one incredibly specific and vital job. The best way to think of it is as your body's personal traffic cop for calcium. So how does this traffic cop actually work? Well, its mechanism is just a beautiful piece of biological design. It directs calcium to exactly where it needs to be, and just as importantly, it keeps it out of places where it can cause a ton of damage. Vitamin K2 has this brilliant two-step job. First, inside your bones, it flips the switch on a protein called osteocalcin. Once it's activated, this protein literally grabs onto calcium in your blood and locks it deep into your bone tissue, making your bones stronger and denser. At the very same time, in your arteries, K2 activates a different protein called MGP, which acts like a bouncer. It finds any stray calcium floating around and sweeps it out of those soft tissues, preventing it from building up and causing plaque. And right there, that is the solution to our paradox. Without enough vitamin K2, that traffic cop is off duty. All the calcium supplements in the world just flood your system, but the calcium never gets the signal to go into the bones. So instead, it just ends up getting dumped in your arteries. And suddenly, you have both weak bones and heart disease happening at the exact same time. Now, it is so important to get this straight. K2 is not the same as its more famous sibling, K1. Vitamin K1, the kind you get from leafy greens like kale and spinach, is all about blood clotting. That's why people on blood thinners have to be so careful with it. But vitamin K2 has a completely different job description. It's the calcium manager, and it comes from totally different foods, like fermented things and animal products from grass-fed animals. For decades, we just lumped them together as vitamin K, completely missing this critical difference. Okay, so this all sounds good in theory, right? But what about the hard evidence? Well, let's take a look at one of the most important pieces of research on this topic, the Rotterdam study. It was a massive, long-term study that gave us some truly jaw-dropping results. I mean, just look at this headline finding. The people in the study who ate the most vitamin K2, and we're not talking about a lot, just over 32 micrograms a day, they had a 50% lower risk of dying from cardiovascular disease compared to the people who got the least. 50%! That's the kind of number that makes everyone sit up and pay attention. And the data is just so clear when you see it laid out like this.
The group with high K2 intake had dramatically fewer heart attacks and strokes, and way less calcification in their arteries. The connection was direct and it was powerful.
But it didn't even stop with heart health. That same group with the highest K2 intake also had a 25% decrease in death from any cause. That suggests that K2's benefits go way beyond just bones and arteries, and that it's playing a much more fundamental role in our overall health. So, the science is really compelling. And the big takeaway from all this is that we need to start making sure our calcium actually gets to the right destination. So let's talk about how we can actually apply this knowledge. You can find vitamin K2 mainly in two places. There's a form called MK7, which you get from fermented foods, and then there's the MK4 form, which comes from animal products. And this is the absolute key, the animal has to have eaten a diet rich in vitamin K1. That means grass. So we're talking about eggs from pasture-raised chickens or dairy and meat from grass-fed cows. The animal's diet is literally everything. Grain-fed animals, they'll have almost no K2 to pass on to you. Ultimately, this whole story, this whole paradox, it boils down to one simple, incredibly powerful idea. The conversation shouldn't just be about how much calcium you're getting. The real, crucial conversation needs to be about where that calcium is ending up. So the question to leave you with is this. Is your calcium going to the right place? Do you have that traffic cop on the job, making sure it's building your bones and not hardening in your arteries?